Welcome to Savitha Dental College lecture cast series in Oral Medicine and Radiology, Infections of Oral Mucosa. Infection is defined as invasion by and multiplication of pathogenic microorganisms in a bodily part or tissue which may produce subsequent tissue injury and progress to overt disease through a variety of cellular or toxic mechanisms. Infections are broadly classified into bacterial, viral, and fungal infections. Bacterial infections are again divided into necrotizing ulcerative gingivitis (NUG), actinomycosis, syphilis, and tuberculosis. Necrotizing ulcerative gingivitis, otherwise known as Vincent's infection, is caused by Bacillus fusiformis and Borrelia vincenti, associated with psychological stress, and is characterized by edematous interdental papilla with punched out crater-like necrosis. The complications of necrotizing ulcerative gingivitis includes necrotizing ulcerative periodontitis and noma. Tuberculosis has various orofacial manifestations such as tuberculous lymphadenitis, tuberculous ulcer, tuberculous gingivitis, tuberculous osteomyelitis, and lupus vulgaris. The treatment for tuberculosis includes antitubercular therapy and DOTS therapy. Syphilis is again divided into acquired syphilis and congenital syphilis. Acquired syphilis has three stages: primary, secondary, and tertiary, and congenital syphilis has Hutchinson's triad. Primary syphilis is characterized by chancre, secondary syphilis by snail track ulcer and mucus patches, tertiary syphilis by gumma formation and lutic glossitis. Congenital syphilis is characterized by Hutchinson's triad, which has Hutchinson's incisors, eighth nerve deafness, and interstitial keratitis. Actinomycosis is caused by gram-positive anaerobic bacterium Actinomyces israeli and is characterized by multiple abscess formation which discharge yellowish flecks called sulfur granules. Viral infections. Human herpes virus is of 8 types. HSV1 causing primary herpetic gingivostomatitis, HSV2 causing genital herpes, varicella zoster virus causing herpes zoster, Epstein-Barr virus causing infectious mononucleosis, cytomegalovirus affecting the parotid gland, type 6 and 7 causing roseola infantum, and type 8 associated with Kaposi sarcoma. Herpes simplex infection has two forms, primary and the secondary form. Herpes zoster is caused by varicella zoster and is characterized by prodromal symptoms and vesicles rupturing to form ulcers, and these vesicles are unilateral and do not cross the midline, and the most common complication being post-herpetic neuralgia. Herpangina caused by Coxsackie virus A1 to 6, 8 and 10. Lesions develop in the posterior areas of the oral cavity and the ulcerations usually take 7 to 10 days to heal. HIV has various oral manifestations such as HIV gingivitis, HIV periodontitis, Kaposi sarcoma, non-Hodgkin's lymphoma, noma, oral hairy leukoplakia, ulcers, oral warts, angular cheilitis, and candidiasis. Fungal infection. The most common fungal infection is oral candidiasis and is divided into primary and secondary forms. Primary is again divided into acute and chronic forms. The most common form of candidiasis is pseudomembranous candidiasis, which is characterized by scrapable white patch with curdled milk appearance and bad taste or loss of taste discrimination, mucosa bleeding on scraping the white patch, and burning sensation. Angular cheilitis is the infection involving the angle of the mouth, and it occurs in patients with reduced vertical dimension, nutritional deficiency, diabetes, AIDS, and neutropenia, and is characterized by erythema, fissuring, and scaling at the angles of the mouth. Denture stomatitis is the most common form of candidal infection found in denture virus and has 3 stages. Stage 1, palatal petechiae, Stage 2, diffuse erythema, and Stage 3, papillary hypoplasia. Thank you.